Now let's talk about vitamin A, retinol. What is it? It's a fat-soluble vitamin that our body uses for many different things. The main function of vitamin A is vision. Okay, it helps us to see in the dark. Well, you get vitamin A from animal products, liver, fish, butter, egg yolks, whole milk, and also cod liver oil. And this is the only form that you can get from animal products like egg yolks, butter, liver. This is the only form that is active. The other forms have to be converted. Alright, so when we're talking about plant foods, you get beta-carotene, which then has to be converted to retinol. Well, you're going to have dry eyes, dry skin, hyperkeratosis, which is like a roughened, red, scaly skin. The average person has a 3-month supply in their liver at any given time. Also, vitamin A increases the resistance to infection. Now keep in mind that these are the requirements to prevent a deficiency. If you want to be in your optimal range, you probably need a lot more. So if you're deficient in vitamin A, you're more susceptible to getting an infection. And out of all the vitamins, probably the one that you have the least amount of data on, because there's not a lot of research on it, mainly because it's kind of overshadowed by vitamin D, which makes up for a lot of the benefits that vitamin A has. But vitamin A is still a very essential nutrient. Alright, thanks for watching. I will see you in the next video. Vitamin A also helps to decrease inflammation. There's several studies on that. And vitamin A also helps regulate cell growth. So if you have too much vitamin A, you could potentially have an increased risk of getting cancer. If you're deficient in vitamin A, you can also have an increased risk of certain cancers as well as a lot of the other symptoms that I just mentioned. You'll have a loss of appetite, diarrhea, especially in children, and of course, you're going to have problems with your vision, especially night vision. You're going to be seeing halos around lights. It's called nyctalopia. And what happens is this: when you consume certain foods that are considered goitrogenic, like kale, for example, it can block this receptor. Now, vitamin A is also needed to help convert beta-carotene into vitamin C, so there's all these different conversions taking place in the body that are very complex. And I'm just giving you the basic overview of vitamin A, so if you're consuming large amounts of kale without cooking it, you might want to consume some liver or cod liver oil to counteract that effect. You also get retinol and retinol esters. These are also precursors that have to be converted. Cod liver oil is one of the best sources of vitamin A, as well as vitamin D, but you can also get vitamin A from plants, leafy greens, carrots, sweet potato, cantaloupe, apricots. All these foods are rich in beta-carotene. Now this is a precursor to vitamin A, so when you consume these foods, your body converts it into vitamin A. However, you must have sufficient protein and no alcohol in order for this conversion to take place. Now, if you're deficient in vitamin A, you're gonna have problems with your vision, especially night vision. Alright, now, 2. What food has the most vitamin A? Yes, it is. If you consume too much of the animal form of vitamin A, the preformed vitamin A, you can develop toxicity. The symptoms would be like headaches, nausea, vomiting, diarrhea, fatigue, irritability, dry skin, hair loss, blurred vision, and even birth defects. Now, if you're consuming plant foods, beta-carotene, it's very difficult to get an overdose from that because your body only absorbs what it needs. So, if you're going to get an overdose of vitamin A, it's going to come from animal products, liver, fish, butter, egg yolks, etc. Now there's many different forms of vitamin A, but the only form that you need to really know about is retinol. Alright, so now let's talk about toxicity. Is it possible to get too much vitamin A? Alright, so what are the symptoms of a vitamin A deficiency? Alright, so what are some of the interesting facts about vitamin A? Well, vitamin A is stored in the liver. Alright, the requirements for vitamin A: 700 micrograms per day for females and 900 micrograms per day for males. There's also something called the retinoid X receptor, or RXR, and it's kind of similar to the thyroid hormone receptor. Also, vitamin A works with vitamin D to help regulate calcium. In fact, vitamin D increases the absorption of vitamin A by 300%. But the point is that vitamin A is extremely important in maintaining good health.